patient speaker is Jason Posavad. Jason has worked for 20 years in the technology sector, and I pulled from his bio that he is a long-suffering Toronto Maple Leafs fan, which I think a lot of us can probably relate to. Jason has been a pancreatic NETs patient for, now every time I say NETs, I'm worried that Dr. Mehta is like, patient for nearly 15 years and currently resides in Kitchener, Ontario with his wife and caregiver, Lucy. Jason?
Thanks, everyone. Good day. My name is Jason Posvad. I am a neuroendocrine pancreatic patient. My journey really began in about 2006 when I was first diagnosed with hyperglycemia and type 2 diabetes. I spent time in hospital on an insulin drip trying to get my blood sugars under control and was prescribed metformin. I've always been a bigger, heavier guy and received some stern advice from the emergency room physicians about the need to reduce my weight and the importance of diet and exercise. Unfortunately, as time progressed over the next couple of years, trips to the emergency room were more frequent and my blood sugars more unstable. My well-being was getting worse, with my energy level not where a 35-year-old should expect it to be. Finally, in late 2008, things came to a head. I was at the Grey Cup in Montreal, and a longtime friend of mine I've known since we were kids noted that I was not looking good and not my usual self. Upon my return home, my condition worsened to the point I could not walk more than about 30 feet without getting very tired. My young, stubborn self refused to seek medical attention, thinking that this would just somehow go away, despite my wife's pleading. My wife, not here today, but totally instrumental, as the Queen said about, her Charles, my stead and stay. So I got up from a chair one morning and collapsed, saw the white blotches, down I went, down goes Fraser. And I said, honey, I think it's about finally time that I have to go to the hospital. I went on an ambulance ride. My wife would still tell you that, despite all that was going on, my biggest concern was that I didn't have any socks on. So, I get to Milton District Hospital and I received a CT scan and a GI scope. I was told via the GI scope that I had some worrisome growths, cancerous or precancerous, I was told, and that my pancreas definitely did not look normal on the CT scan. One physician could not believe I was not experiencing any abdominal pain. I'll never forget this shocked look on this, young, I guess he was a resident or an intern, and he just had his jaw dropped. He just kind of walked away, and I'll never forget that. It was, I smile thinking about it now, remembering it. I was told that the tumors had grown so large they were pressing on blood vessels, and it was causing internal bleeding. So that's what was causing the the weakness. The type 2 diabetes was really my pancreas being impeded from producing insulin. And so my cancer journey began. And at this point, I was 37 years old. My wife and I had been married for about a year and a half, and I had just finished my MBA. When they first told me you got cancerous growth, I thought, great. That MBA, boy, that was a real good use of time now, wasn't it? After getting out of hospital, I was first told I had lymphoma, and chemotherapy could clear it up. The example I was given was Mario Lemieux. I'm a hockey guy, so that resonated with me. Then the biopsy results came back. They were able to get a little piece, and I received a call telling me that I had carcinoid. Now I have to learn about NENs, and that they actually do surgery for that. It was a very confusing and anxious time, something I was completely unprepared for. It was certainly not, certainly not something that was, prepared for. Somebody suggested that I reach out for help, and I found CNETs. Many volunteers spent time with me to share their stories and what I could expect in the days ahead. Maureen Coleman, the founder, was among them. It certainly brought me comfort to me that I, had a chance to carry on with life. I was told that Milton District could not handle a complex case like mine. They didn't have a surgeon that was qualified to, perform operations in the mid-abdomen. So they referred me to Hamilton, to the Juravinski, to an HPB surgeon. More testing happened, including a GI scope and an octreoscan scan were performed. This confirmed that my cancer was in fact NETs and that I could receive surgery. Unfortunately, I was told that my tumors were so large that my entire pancreas had to be removed via a total pancreatectomy, not a Whipple, along with my spleen, gallbladder, part of my duodenum, part of my stomach, and my appendix also while the surgeon was at it. The surgery was performed about 3.5 months after diagnosis, and a tumor 5 centimeters by 5 centimeters by 15 centimeters was removed. That's about roughly the size of a tall boy beer can, so I'll call my tumor my beer can. I was in hospitals for 7 days and slept most of it. It did, however, give me a chance to work with a diabetes nurse to learn how to inject myself with insulin. I'm not a very good listener, but I still remember some of her exact words over 14 years later. Recovery from the surgery started off well, but stalled as my hemoglobin remained stubbornly low due to all the blood transfusions I required during surgery. 9 units of blood, if I recall. By the fall, I was fully recovered, about 6 months, and I felt pretty good. The pathology report came back that I had a Ki-67 of 5%, and the tumor was non-functioning. Good news on both fronts. I was also told I had no identifiable cancer remaining, but some lymph nodes had to be removed, and I may at some point down the road, we could see a recurrence. I was referred to the Juravinski Cancer Center in Hamilton for regular follow-up. Over the next 2 years, I received follow-up every 6 months with my blood work and an annual CT scan. After 2 years, liver lesions were detected, and what we think, cancer was back, and what we think happened, looking back, was that the metastases were always there. It's just that they didn't light up on the octreoscan. Very important. It's been, that has caused me some grief over the years. Cancer was back, and this time it was not going away. It seemed few options existed at the time. PRRT was not yet on offer, nor was CAPTEM. Regular chemo was not deemed likely to be successful due to the slow growth nature of my tumors. Most concerning was that an octreoscan didn't show any uptake on the liver metastases. So I wouldn't be eligible for PRRT, even though the original primary tumor did light up. So a lot of confusion there, and the octreoscan, unfortunately, isn't as sensitive, so it created some confusion in my case. My oncologist advised that she had something for me after a time called Afinitor via clinical trial. Supposedly an article had just been published in the New England Journal of Medicine. So this was all right about 2011. I stayed on Afinitor for 4 years progression-free and experienced no serious side effects. I also learned about mTOR inhibitors, mammalian target of rapamycin, and I'm still amazed by that story, that someone had the presence of mind to dig up some dirt from the Easter Islands and bring it back. After 4 years, scans showed some progression in my liver tumors, and another treatment had to be tried. This time it was Sutent. At first, we saw some actual reduction in tumor size. However, side effects were more pronounced compared to Afinitor, a little bit more tired and the like. After about 1.5 years, some progression was noted and yet another treatment was required. I managed to get a gallium-68 scan at Princess Margaret, which came back positive and finally confirmed that I could be eligible for PRRT. So this is at this time about 7 years of confusion with no real roadmap. Right about that time, the company I worked for had what was called a second opinion program. And I was fortunate that I could gather up all my medical records, shipped them off to a company in Boston that went through them all and picked out all the good stuff, and then said, well, where do you want to ship this to? And I said, well, I think Uppsala University is, I've heard that they do a lot of research on nets there. And they said, oh, okay, we'll send it there. So 2 months later, I got back a report detailing a roadmap for me, something that I didn't have to that point and was very, very thankful for. After about a year and a half was noted, another treatment was required. This time Captain was tried, and again on a clinical trial. Captain was much more involved with a 14-day cycle, 9 days on capecitabine, 5 days on both capecitabine and temozolomide. Side effects were quite pronounced to the point that I could no longer work. My energy level didn't allow it. I think after 26 cycles of Captain, I was told it would be dangerous to take anymore. You might get leukemia. I also was told my tumor burden was reduced by about half, making this treatment well worth it. I remained essentially progression-free for 2 years afterwards before I was told some progression was noted and more treatment would be required. Having exhausted all targeted therapies that were available at the time, I was told surgical options would need to be pursued. Before any treatments were done, I had a biopsy which found my Ki-67 had increased over the previous 10 years from 5% to 10%, as was to be expected. Moving to treatment, RF ablation was first tried, but unfortunately it wasn't successful. I was then referred to London Health Sciences for Y90 transarterial radioembolization. It took a few months to get seen, but eventually I received my Y90 tear, targeting 3 tumors. The procedure was remarkably quick and relatively painless, and I was home mid-afternoon that same day. About 3 months later, I was told 2 tumors showed a complete response and 1 a partial response. Unfortunately, I did have some complications with a liver abscess that developed afterward. I've never been so sick in my life, and that I'm really only, almost as I stand here, really fully recovering from. I was sick for about 4 months, in the hospital for about 3 weeks. They warn you about this beforehand as a risk, so if any of you are going to be candidates, keep that in mind and listen carefully when they're explaining these risks to you. They're real. There's no telling exactly what is ahead for me or what the outcome may be. If I knew what I know now nearly 50 years ago, I would have been thrilled. The last 15 years have been terrific, probably the best years of my life. I've received treatments that nobody knew existed back when all this started. I hope that those that come after me will do even better and worry a little less than I've had to. Thank you very much.
Thank you so much, Jason, for sharing your experience. And our final patient